How many times you have either been asked by somebody who takes care of what, like a friend of yours gets sick, or unfortunately maybe you've been ill or something and get a particular disease and diagnosis, and you want to know, who should I go see? We get calls like this all the time. And at major medical centers like UCSF, where I work, we have 1,400 physicians there. And I get called all the time to be asked, who should I send my daughter to, or whatever. And that problem, interestingly, has not been solved simply by having a search engine that looks up specialists. We're a company that is newly formed. Spencer Hunter is our CEO. I co-founded the company with two others. Janine Smith is our Chief Medical Officer. Maden joined us from Oracle recently to write code much better than I could write it. And then Marcy Keenan, who's here, is our Vice President of Business Development. We are trying to solve this issue. Patient gets a particular diagnosis and says to their specialist or to their primary care doctor, well, okay, now you think that I might have a melanoma in my arm, who should I go see? And the way that this is done currently, and I'm sure many of you have experienced this, is that they will either go to call up a physician referral line, they'll call UCSF, we have an 800 number, and say, I have a patient who might have melanoma. That doctor might look through these things called referral guides that have lists of doctors in it, and by keywords, what those doctors do. Here's a dermatologist, or here's someone who might specialize in melanoma. Some of this is on a website portal that's available to the public. There's also internal things that medical centers use to try to figure this out. But more commonly, this is what happens. Hey, I had that problem. I had a friend who had it. Who did you go see? And so this word of mouth phenomenon occurs all the time. Lastly, VIPs or deans or other people call us and say, hey, wait, you're prominent in the stroke community. Who should you, and you're a neurologist, who should I send this person with a neuropathy to? Neuropathy has nothing to do with stroke. It has something to do with neurology. So why am I now the resident expert on it? Well, I'm not. I might make mistakes in saying who they should see. So what we've chose to solve was basically linking any disease known in the nosology of medicine, which there are quite a few, or any procedure, who's the most relevant doctor to see it. So because of this, I think, again, to restate it, the reason why we have a problem here is that specialists and super specialists are becoming much more specialized. I'm in a tight silo where I see a very narrow group of patients because of my areas of interest in academic medicine and how I practice. So finding the right person as a neurologist, that doesn't describe me terribly well. So we want to redefine that. We want to be able to profile specialists through a different method that doctors will look at and say, oh, that makes sense. Right now there are other ways that doctors are profiled on the internet, and I can tell you as a physician, none of those work. None of those describe what I actually do. And that's what we've built. So the tool that matches physicians with diseases also has never been built. And it's not too complicated, but it has a high barrier of entry, which is you've got to get the information from the doctors. And that's something that we can solve. We think that we can do this this is an example where someone might type in diabetic neuropathy. Someone who has diabetes, who's losing nerve function in their legs, their fingers are tingling, their toes are going numb. Who is the doctor at UCSF, at Mayo Clinic, at Massachusetts General Hospital who really specializes in that? Well, here's the list. And we give a rank order of docs, not by their outcomes, but by their relevance. How much time does that doctor spend seeing that particular disease for all diseases in medicine? We provide that for the medical center. We do this by profiling doctors. This is the part that, at being a physician, no one has solved, which is take you to a site that says you're a doctor who has this particular area of training, then what do you actually do with your time? What do you spend seeing? Do you spend a whole lot of time seeing diabetic neuropathy? Do you see stroke patients? Do you see what? And to try to figure out, based on the idea that the more you do of something, the better you are at it. And I think in terms of medicine, that motive has stood up a pretty good test of time. So by figuring out how you spend your time through a user interface that takes no more than 90 seconds for a doctor to complete, and docs are time crunched just like all of the entrepreneurs in this room, we can find out this unique information. So for a person who type in Mohs surgery, which is a surgery that's done for patients who might have basal cell carcinoma or melanoma, for example, you want to know in one click from typing in the disease who's most relevant to take care of that. And then we link back to the internal IT structure of the hospital to give biographical information or others about the patient, about the physician. It's good for the patient because the patient sees the right doctor in the first place. Nothing is more frustrating to a patient than to be told, you need to go see Dr. Smith at UCSF because he's really good at something. And they come in and see me, and it turns out that actually I don't spend my time doing that. But there are 5 other doctors in the adjacent building, actually, who spend all their time doing that. So not only did they wait a while to see me, they got put back in the queue to go see somebody else. How frustrating. Secondly, if they're going to be seeing me for a disease that I might be trained in but don't spend a lot of time doing, am I going to give them the best care? And I think getting the patient to see the right doctor in the first place is a problem that just has not been solved at every major medical center that we visited. So we've talked to UCSF, to Mayo Clinic, to UCLA, to Columbia Presbyterian, to Johns Hopkins, and have asked them, so what do you guys do? And they all said, Columbia was one of the best stories, was, well, my secretary's been there for 25 years and she pretty much handles that. So one person at Columbia University, 2,000 physicians, and there's one person who kind of says, well, I think you probably should go see Dr. So-and-so. That's the state of the art, and that's what we solve. We fix this and make it much more convenient. What we've done so far, we raised our first round of capital. We raised $1 million at the end of February. We have a patent, it's our seed rounds there, we built our team. We built the first version of this, which we've used as a beta site to secure contracts with UCSF. UCSF is going to be our first beta site because that's home. We want to capture the top 25 hospitals in the second year, that are the major medical centers that have this silo of a whole group of super specialists. So that if you go to U.S. News and World Report and look at the top 10 hospitals in their ranking, we're going to them to say, can we build this for you so we can gain the information about your doctors to help your referral process be more efficient? And in the end, we end up with a data set that has never been collected. What do doctors do with their time? The top doctors in America. We would like to bring this out to consumer search. Our first approach, though, is to actually work within the medical centers to first make sure that doctors buy the brand, they're interested in it, they're going to give us the data that we're most interested in getting, that it works well for the medical centers, and then partner with other companies which actually have this, which don't have this tool. So to summarize, it's really the healthcare search space, as you know, is huge. But the one element, so go ahead and try this tonight. I want you to go home and I want you to say, I have a stroke. And you want to find out who is the person that's within your 5-mile radius, 20-mile radius, or 100-mile radius that can actually take care of your disease for you. Who, if your mother actually had a medical condition, you wanted to find out, but you don't live in the same city as she does, you want to find out who is the doctor to see them. Try to figure that out. Tell me how many clicks it takes, tell me how long it goes, and tell me in the end how comfortable you were with the data that you got. That challenge is an easy challenge to make because it just isn't there. We're going to solve that, and I appreciate your time.